Okay, Assalamualaikum. DJ Sham here, heart health enthusiast and heart attack survivor. Today I'm with Prof. Anwar, who is a rehabilitation consultant physician. So why am I talking to him? Well, just so, hang on. All right, here we go. Because, as you know, I did angioplasty before. I've had a heart attack, first at the age of 34. But one thing I missed out on was rehabilitation, which is cardiac rehabilitation program. 100% only on cardiologists. So first, okay, Prof, why don't you tell me first, what's the difference, cardiologist and then rehabilitation consultant? What's the difference between the two?
The stark difference, we are all doctors, so we are all physicians by training, but cardiologist basically fixes the heart, if I put it in layman's term. Now after the heart or the machine is fixed, how are you going to use it? How are you going to improve on that function? So that's basically the whole rehabilitation process. It's not just done by the rehab physician, we have a whole team. So you've met our physiotherapist, occupational therapist, dietitian, pharmacist, but essentially the rehab physician has to make sure that this is safe. So not everyone gets in. They will get in a different time point, but the safety is our main concern. So to make sure that you're actually safe to participate in cardiac rehabilitation and the outcome is the best for you, there needs to be a form of assessment. Then we tailor-make the intervention. So you're young, you have a lot of things going for you, as compared to someone who's a bit more senior or a different lifestyle. The game is different. Okay. So that tailoring bit is done by the rehab physician together with the team. So they will execute, we will check, and this check and balance. And I think the hallmark of cardiac rehabilitation has always been the safety. So, to you probably is, when you go to the gym, everyone's just exercising, having a good time. But the behind the scene, that process of prescribing the exercise, of monitoring and looking at the outcomes. So the outcome is very important because it's not just about survivorship. We're not talking about just surviving. We're talking about improving your function, attaining the highest level of quality of life. So that is, in essence, what rehab is.
So that's the whole idea, and that's the reason why I agreed to this, because I think a lot of people who are in their 30s or even 40s or early 40s active, and then once kena heart disease of some sort, they want to go back to being active and they think it's okay. I was made to understand this particular CRP program that I'm on is kind of like a new thing for you guys, where it's a collaboration between this department, that department. Can you elaborate on that and why?
So very interesting that you started with 30s and 40s. You know why? Because when we were in medical school, never heard of anyone getting heart attack in their 30s. 40s, it was like what, 70s, 80s, right? And you reflected on the scary trend that we're seeing nowadays.
It is a trend. It is a trend,
and it's not over the seas. It's right in your own backyard, in our own backyard. So you're seeing younger males and females together. People always think heart attack is a male's problem. No, we also have yes. And then the sad thing is the system, I'm just putting the system, doesn't know how to respond to when females get heart attacks. So it's like a male disease. So anyhow, let's come back to your question. So yes, you're right. Rehabilitation itself is not new. Cardiac rehabilitation has been around in Malaysia for the last 20 years. So maybe relatively new compared to the other types of rehabilitation that we've been doing. But we have had significant amount of progress in the last 10, 15 years. I was there for we have now 4 to 5 national clinical practice guidelines on cardiac rehabilitation. So this is the books that the doctors read, these guidelines. And in these guidelines, the word cardiac rehabilitation is specifically mentioned, meaning to say that the medical family or fraternity has actually endorsed and put in cardiac rehabilitation as something mandatory. Now the question is, why is a lot of people missing out on it? And that is where I think what you're doing right now is very commendable, and I applaud this, because awareness is one thing. You have the knowledge, but if you don't have awareness, people who needs this, people who should be getting this, are not getting it. And you'll be like, you're young, just jumping into the work. That's the danger. Too little knowledge sometimes is really the danger. So yes, it's run by a few teams, just because, like, you're a good example. You're not just any individual, you are also active in sports, you go back to work. So we've got dedicated teams that looks into specific parts or specific human function. And that's just showing how diversified we can customize this program to suit your needs.
30s or 40s, they want to be active. Is it part of the problem when when we've heard of people cycling, feeling okay, but suddenly dropping.
Yeah, two sides of the coin.
Okay.
One side of it, we are getting more health conscious. So we actively screen, we actively look out for ourselves, which is good. So that means you pick up things like, high blood pressure and diabetes and at a younger age, which possibly has been around, but we never sort of, I run as in, in the previous generation, but we wait until we are 40s and 50s or when we start to retire, and then that's when we look, when you sign up for insurance, maybe, that's when you probably start looking at whether you have all these medical conditions. But I think right now, the flip side, which is the scary bit, it's got to do with the lifestyle. It's got to do with the times that we are in. Undeniably, you see the level of stress. When I say stress, I'm not just talking about, stress with work.
Okay.
Talking about performance, the demand, the and then the amount of changes that has happened to our lifestyles. When we were growing up, have you ever heard of getting anything after 10 p.m. at night in terms of food?
No.
Nowadays, we are championing it 24 hours. You can get access to food. This is probably not the best example, but I'm just giving you an example how things have changed. For better or for worse. No, you can say the same thing about social media. It can be of good. You can abuse it as well. So because it's there, consumption, overconsumption, misconsumption, all of this contributes. So I'm just putting it out very general. But I think right now, the pace that we are living in, it's amount of stress, amount of demand, and maybe the way we adapt is not helpful in bringing down the level of stress. How does the body respond? Because you got to get up, you got to show up, you get to perform every day. We are probably not forgiving to ourselves as how we are probably to others. So because of this, the amount of physical, mental stress, and nowadays we are very open to talk about mental health, which I think is very, very good. Because essentially, cardiac disease is not the disease of the rich anymore. It's actually a disease of a lifestyle. It's the options that we make. It will snowball into one result. So it's either you get a brain attack, called a stroke, or you get a heart attack, or you get blockage in the vessels in the leg. Can I also say one thing? Erectile dysfunction.
Is this a heart issue? It's circulatory?
Yes, circulatory is the same system. So now we're like, whoa, no wonder we are seeing more people, younger people getting erectile dysfunction. It's got nothing to do with sexual problem. No, not entirely nothing. But it's, how we encourage women to do breast self-examination? Erectile dysfunction is one of the earliest signs of systemic blockages. And yet, we always think about it as a performance issue. And we don't think about it as a cardiac issue. That's where I think, the not the misconception, but the knowledge needs to be turned into something that empowers people to help themselves.
Even for myself, I was a person who had a heart attack and I thought, still young, let's just go in. But when I got into a CRP program, cardiac rehab program that is done here, with you leading the way and with the therapists over here, this is where I've learned a lot of things. For example, it's more about, because I always say that people come up to me, the nature of the business that I do, people come up to me, dah sembuh dah your heart. So I say, what do you mean by that? Because what I understand with heart disease, you get an attack, your heart is not the same anymore, but you need to find a way to live with the heart you got. And to do that, you need to look on the inside. That's why CRP to me is very, very important. I think there is a saying where, yes, medicine, yes, cardiologists and medicine, very important things, but is it sports is also medicine?
Yes. Exercise is medicine.
Exercise is medicine.
Sports is a part of exercise. Exercise is medicine. So what is that? That's lifestyle, isn't it?
It is. So with CRP, you'll be able to know limits and whether you can push a little bit more. And that's how you want to get active, especially if you have gone through an angioplasty and missed out on your CRP. I would highly recommend that you do a CRP program over here. Now, you want to know exactly what, DM me and I'll give you the information. Now, what about those who they are not diagnosed, they have never gone for an angioplasty, but they are concerned that they want to be better people in genuine lifestyle. Where can they go?
So basically, there's primary and secondary prevention. So the main difference is primary prevention is to prevent the first ever heart brain attack, or even blockages into any vessels in the body.
Okay.
So that can be done, generally it's done by your family care physicians, your primary care physicians, family doctors, GPs, because essentially you don't have a disease, you just have a condition, non-communicable disease as they call it, the triad of blood pressure,
Okay.
diabetes. That is again, of course, lifestyle, but it can be done at a more basic level. You can monitor, and the crux of the whole management is going to be lifestyle.
Okay.
The food you take, the exercise and whatnot. But when we're talking about an established disease or condition, you are already a clinical population. Strokies, cardiac patients, they're all clinical. You need a little bit of monitoring. Okay. It doesn't single you out, but exactly what you say now, Shang. You can't see the heart. So in a way, people just look at you physically, say, yeah, you're fine.
I get that a lot.
But you, as the one who runs the heart, owns the heart, you know your limits. So this is where we empower you with two things. The knowledge, you must understand what you're having specifically. Number two, don't let the knowledge hold you back. Skills to manage your limitations. So I think the skills bit though, I mean, knowledge you can get from all sorts of places. Whether it's the right knowledge or wrong knowledge is another question.
Correct.
So find reputable sources. But number two, how do you use the knowledge? Because without the skills of managing that, you can very well run into deeper waters and more trouble, whereas you're on the right track of recovery. So that's where secondary prevention comes in. So it's not just about repeating the same process about preventing diabetes, hypertension, but also you already have one more challenge, not problem, challenge. It's called the cardiac problem, cardiac disease. And how do you navigate through that to overcome? We humans, we are always in a cycle of getting beaten down, getting up again, worn down, getting up again. And that's the essence of rehab. The work means to live again. Rehabilitation is to live again. So through whatever it be in our lives, we're going to try to overcome.
All right.
If not be better.
Great. So I'm going to close it with, I bring a message of hope, especially those who have suffered from a heart attack, gone through angioplasty, or even stroke. It can be along the same lines, right? So if you have gone through that, there are two sides of the coins here. One, you are afraid to be active. To me, don't be afraid. You are able to do it, able to be competitive, but you got to go through CRP to know limits first. The other side of the coin is when it can be dangerous as well, where you just jump straight into being active lifestyle, intense workout without knowing what's going on inside. So you can, but you need to have that awareness and knowledge, and it comes at CRP. All right? So I think that's it. Thank you so much, Prof. Anwar, for spending time with me. And what we do hope is that it inspires other people and gives hope to other people for a better, healthier life. All right? Take care.
Thank you.